Breaking down the dementia test, what to expect and why it's important. Dementia is a debilitating condition that affects millions of people worldwide. It is a progressive disease that causes a decline in cognitive function, including memory loss, confusion, and difficulty with language and communication. Because it is a progressive disease, early detection is essential for managing symptoms and ensuring that patients receive the best care possible. One of the most common ways doctors diagnose dementia is through a dementia test. In this post, we will break down what to expect during a dementia test, why it's important, and how it can help identify and manage the disease. We will also discuss how to prepare for the test and what to do if you or a loved one receives a diagnosis of dementia. Whether you are concerned about your own cognitive health or that of a loved one, this post will provide valuable information on the dementia test and its significance in the battle against this challenging condition. 1. The definition of dementia. Dementia is a term used to describe a group of symptoms that affect the ability to think, remember, and reason. It is a general term that encompasses a range of cognitive impairments, including memory loss, difficulty with language, and problems with decision-making and problem-solving. Dementia is not a specific disease, but rather a group of symptoms caused by a variety of underlying conditions. These conditions can include Alzheimer's disease, Parkinson's disease, Huntington's disease, and many others. Dementia can have a profound impact on the person experiencing it, as well as their loved ones and caregivers. It can cause confusion, frustration, and emotional distress, and can make it difficult to carry out everyday activities. As dementia progresses, it can also lead to more serious health problems, including an increased risk of falls, infections, and other complications. It is important to note that dementia is not a normal part of aging. While it is more common in older adults, dementia can affect people of all ages. It is estimated that there are currently over 50 million people worldwide living with dementia, and this number is expected to triple by 2050. As such, understanding the definition of dementia, its causes, and its symptoms is crucial for anyone who may be at risk or caring for someone who is at risk for developing the condition. 2. How dementia affects the brain. Dementia is a term used to describe a group of symptoms that affect the brain's ability to function properly. It is a progressive condition that typically affects older adults, though it can also occur in younger individuals. Dementia can impact a person's memory, language skills, ability to think and reason, and even their personality and behavior. The brain is made up of billions of nerve cells that communicate with one another through electrical and chemical signals. In a healthy brain, these signals are able to flow freely, allowing for quick and efficient processing of information. However, in a brain affected by dementia, these signals become disrupted, leading to a range of cognitive and behavioral changes. One of the hallmarks of dementia is the accumulation of abnormal proteins in the brain, such as beta amyloid and tau. These proteins can interfere with the normal functioning of the brain, leading to the death of nerve cells and the formation of plaques and tangles. As a result, the brain becomes less able to process information and carry out everyday tasks. There are many different types of dementia, with Alzheimer's disease being the most common. Other types include vascular dementia, Lewy body dementia, and frontotemporal dementia. Each type of dementia affects the brain in a slightly different way, leading to unique symptoms and challenges for patients and caregivers. Understanding how dementia affects the brain is crucial for developing effective treatments and interventions. By targeting the underlying causes of the condition, researchers and healthcare professionals can help slow the progression of the disease and improve the quality of life for those affected by it. 3. What is the dementia test? The dementia test is a series of assessments designed to determine a person's cognitive functioning and whether or not they are experiencing any memory loss or other symptoms related to dementia. The test typically evaluates the person's ability to think, reason, remember, and process information. During the test, the person may be asked to complete tasks such as recalling information, solving problems, and recognizing shapes and patterns. The test may also include a physical examination, blood work, and imaging tests such as an MRI or CT scan. It's important to note that a dementia test is not a single test, but rather a series of assessments that are tailored to each individual's specific needs and symptoms. The results of the test can help doctors diagnose dementia, identify the specific type of dementia, and develop a personalized treatment plan to manage the symptoms and slow the progression of the disease. While taking a dementia test may seem daunting, it is an important step in getting an accurate diagnosis and access to the appropriate care and resources. 4. Why is the dementia test important? The dementia test is important because it can help diagnose and treat dementia at an early stage. Early detection is crucial because it allows individuals and their families to plan for the future and make necessary lifestyle changes. Furthermore, early intervention can help slow down the progression of the disease and improve the quality of life for those with dementia. The test can also help rule out other medical conditions that may present with similar symptoms to dementia, such as depression or a vitamin deficiency. Overall, the dementia test is an important tool in the diagnosis and management of dementia, and it is recommended for anyone experiencing symptoms such as memory loss, confusion, or difficulty with daily tasks. 5. The different types of dementia tests. When it comes to diagnosing dementia, there are several different types of tests that a doctor may use. One of the most common tests is the Mini Mental State Examination (MMSE). This test involves a series of questions and tasks that are designed to assess a patient's cognitive abilities, including memory, attention, and language. The MMSE is a quick and easy test that can be administered in just a few minutes, making it a popular choice among doctors. Another common test is the Montreal Cognitive Assessment (MoCA). This test is similar to the MMSE, but it is more comprehensive and covers a wider range of cognitive abilities. The MoCA takes about 10 to 15 minutes to complete and is often used when a doctor suspects that a patient may be experiencing early signs of dementia. In addition to these cognitive tests, doctors may also use imaging tests to help diagnose dementia. Magnetic resonance imaging (MRI) and computed tomography (CT) scans can be used to detect changes in the brain that are associated with dementia. It's important to note that there is no single test that can definitively diagnose dementia. Instead, doctors will typically use a combination of different tests and assessments to make a diagnosis. If you or a loved one is experiencing symptoms of dementia, it's important to seek medical attention right away to get a proper diagnosis and start exploring treatment options. 6. Preparing for the dementia test. Preparing for a dementia test can be a daunting experience, but it's important to remember that it's just a test to help determine your cognitive abilities. It's also important to remember that there's no need to study or cram for the test, as it's designed to be a reflection of your current cognitive abilities and not a test of your intelligence. Make sure you're well rested and have eaten before the test, as fatigue and hunger can impact cognitive abilities. If you wear glasses or hearing aids, make sure they're clean and in good working order. It's also important to have an open and honest conversation with your doctor about any concerns you may have or any symptoms you've noticed. This will help the doctor get a better understanding of your cognitive abilities and help determine if any additional testing or treatment is needed. Finally, it's important to remember that the test results are just one piece of the puzzle and don't define your worth as a person. If you do receive a dementia diagnosis, there are resources and support available to help you and your loved ones navigate this new chapter in your life. 7. What to expect during the dementia test. If you or a loved one is going through a dementia test, it can be a daunting experience. However, it's important to remember that the purpose of the test is to assess cognitive abilities and determine if there are any signs of dementia or other cognitive impairments. The test is usually conducted by a healthcare professional, such as a doctor or a neuropsychologist. The test can take several hours and will involve a series of questions, activities, and assessments. Some of the things you can expect during the test include questions about personal history, such as education and work experience, as well as current symptoms and concerns. You may be asked to recall information, perform simple calculations, and complete tasks that assess your attention, memory, language skills, and problem-solving abilities. You may also be asked to draw simple pictures or copy shapes to assess your visuospatial skills. Overall, the test is designed to provide a comprehensive view of your cognitive abilities and to diagnose any potential cognitive impairments. While it may be a challenging experience, it's important to stay calm and focused during the test, and to answer each question as accurately as possible. Remember, early detection and diagnosis of dementia can lead to better treatment and management of the condition, so the test is an important step in ensuring the best possible outcomes for you or your loved one. 8. How the dementia test is scored. The dementia test is scored based on a points system, with each question or task assigned a certain number of points. The total number of points earned by the patient is then used to determine their cognitive function and whether they show signs of dementia or Alzheimer's disease. The test is typically divided into several sections, each of which assesses different areas of cognitive function such as memory, language, attention, and problem-solving skills. A score is assigned for each section and the total score is used to determine the overall cognitive ability of the patient. It's important to note that a dementia test is not a definitive diagnosis, but rather an assessment tool that can help healthcare professionals identify potential cognitive issues and determine the appropriate course of treatment. A low score on the dementia test may indicate the need for further testing or more intensive medical intervention, while a high score may suggest that the patient is at a lower risk for developing dementia in the future. Ultimately, the dementia test is a valuable tool for identifying potential cognitive issues and ensuring that patients receive the appropriate care and support they need to maintain their cognitive health and quality of life. 9. Understanding the results of the dementia test. Once you have completed the dementia test, it's important to understand the results. If you have been diagnosed with dementia, it's important to remember that there is no cure, but there are treatments available that can help manage symptoms and slow down the progression of the disease. It's important to work with your healthcare provider to develop a treatment plan that is right for you. If you have not been diagnosed with dementia, but you are experiencing memory problems, it's important to take steps to improve your memory and cognitive function. This may include getting more exercise, eating a healthy diet, getting enough sleep, and engaging in activities that challenge your brain. It's also important to stay socially engaged and connected with friends and family. Social isolation can lead to depression and cognitive decline, so it's important to stay connected and engaged with others. Overall, understanding the results of the dementia test is crucial in managing the disease and improving your cognitive function. Remember to work closely with your healthcare provider and take steps to improve your overall health and well-being. 10. What to do if you or a loved one has a positive dementia test result. Receiving a positive dementia test result can be a scary and overwhelming experience for both the person being tested and their loved ones. It's important to remember that a positive result doesn't necessarily mean the end of the world. While there is no cure for dementia, there are many treatments and therapies available that can help slow down the progression of the disease and improve quality of life. The first step after receiving a positive result is to seek out support and resources. This can include talking to a doctor or specialist who can provide more information on the disease and what to expect, as well as connecting with local support groups and community organizations that can offer assistance and guidance. It's also important to make any necessary lifestyle changes to help manage the symptoms of dementia. This can include eating a healthy diet, exercising regularly, getting enough sleep, and engaging in mentally stimulating activities, such as puzzles or games. For loved ones, it's important to remember to take care of yourself as well. Caring for someone with dementia can be emotionally and physically taxing, so it's important to seek out your own support and resources, such as respite care and counseling. While a positive dementia test result can be difficult to come to terms with, it's important to remember that there is still hope and help available. With the right support and resources, those living with dementia and their loved ones can still lead fulfilling and meaningful lives. We hope that this article has helped to break down the dementia test and provide clarity on what to expect. It's important to understand that these tests are designed to help diagnose and treat patients with dementia, and early detection is key to managing the condition. While the test can be daunting, we hope that we have helped to alleviate some of your concerns and provided helpful information that will allow you to approach the test with confidence. Remember, if you or a loved one are experiencing symptoms of dementia, it's important to seek medical attention right away. Thank you for reading, and stay healthy.